Good morning. I'm Dorothy Rupert, and I was fortunate enough to serve from 1986 to 2001 when I was term limited. I served in the People's House, this beautiful building behind us, which so represents to me Colorado and Colorado people getting together to do what's right, to support and help each other. I'm here to tell my story, and I'm going to go back just to my youth for one moment to tell you that in the 30s, in the height of the Depression, we were very, very poor, living on a farm. My grandfather died, my mother was a single parent, and she had to put my brothers and me in a children's home. This was in the 30s before the New Deal got a good start. But I'm telling you, this is kind of where I come from. This is my center, that we learn how we can take care of each other. You've just heard about the needs for long-term care insurance, and I would support that since my last day in the Senate right here, that afternoon, actually in the morning it happened, but we didn't know what all had happened until the afternoon. My husband crashed with 2 major strokes, and that was in 2001, so 8.5 years ago. He's been in full care since then. He doesn't know us. He has no recognition much at all, but we did not have long-term care insurance, and I did talk with friends about that after this happened to me and to Dick and to our children. Actually, I had tried earlier to get some for Dick, but he was turned down because they said his memory wasn't good enough. He couldn't remember a list of numbers. So I'm encouraging you to do what some of the speakers have said before me, is to look into it early and when the premiums are maybe manageable. So I'm encouraging you to look at that, but I'm also pleading with you to think about the words we use and the ideas we have about how we care for each other. Emily Dickinson said, "A word is dead when it is said." Some say. I say, it just begins to live that day. And we use words sometimes about each other that I think maybe we don't understand what they really mean. When we talk about, and I worked 10 years straight here in the legislature trying to get a study done of access to health care in Colorado. My passion in this house was health care and access to health care, access to education, access to clean air, access to information. And that is what I'm pleading with you today, to think about how we all can have access, all of us. I'm very much in the middle. I'm not really rich by any means, and I'm not really poor. And can pretty much take care of themselves, and the ones who are poor, so far we are supporting them and helping them to have care. It's those of us in the middle. But I'm asking us to look at what we can do, first of all, to educate ourselves. Many people, when Dick crashed, many people of my friends thought that Medicare took care of that. Well, you've heard the stories. You know that that isn't true, not for long-term care. So educating ourselves, but also understanding that we belong to each other, folks. We absolutely have to look at this as an issue of how we all work together. I'm encouraging you to call your senators, Bennett and Udall, and ask them to support the option before the Senate right now that is President Obama's bill. I'm asking you to support Governor Ritter and what he's doing here in the state of Colorado. What I'm pleading with us is to look at how we use terms like socialism. When that was said to me in this house right here, I'd say, every year when I bring up the bill to have access to Colorado's, or for all of us to look at, this was not to make anything happen, it was to look at what we're doing, and I had money for it, and every time it was turned down because my colleagues would say that's socialized medicine. And I think, you know, using these terms, what is a word? A word has lots of power. Think about what that really means. Does that mean, honestly, looking at and taking care of each other? Many pieces will fit together, I think, in the long run. I was born in 1926, and folks, I want to be around here long enough for us to see where we can have access to, yes, good long-term care insurance, but also that we take care of each other. So I'm pleading with you to look at the words we use, how we are going to work together to have the best system for all of us. If it's single payer, which I believe in, then let's work for it, along with taking care of your health, eating apples, and doing whatever it is that takes good care of you and your family, including tons of love. Thank you.